Hey YouTube, welcome back to my channel. My name is Dr. Daniel Kaplan and my mission is to make psychology accessible to all. In today's video, we're going to talk all about alcohol and alcohol use disorders. First, we're going to talk about how frequently it is consumed within our society. Then we'll talk about the criterion for the diagnosis. And afterwards, you're going to learn all about blood alcohol concentration, and we're going to dispel a few myths along the way about how to sober up. Then after we talk about BAC, we're going to enter a discussion on the differences across various communities, and then we'll conclude with the effects of alcohol on society. So without further ado, let's talk about alcohol use disorders. As can be seen on this slide, nearly 2/3 of all Americans drink alcohol, and about 1 out of every 16 people above the age of 11 are considered heavy drinkers, which means that they have drinks on at least 5 occasions per month, and this ratio is nearly 3-to-1 for males relative to females. Now, keep in mind, heavy drinking is not the same as having an alcohol use disorder. We'll see the ratio for alcohol use disorder is more in line about 2-to-1. So when a person drinks alcohol, the active ingredient is ethyl alcohol or ethanol, which is the active ingredient in beer, wine, hard liquor, and the general high that a person gets is because the ethanol is absorbed into the blood through the stomach lining, and then it goes into the bloodstream and the central nervous system. So typically, the short-term effects of drinking alcohol is it tells the neurons to relax. So alcohol has GABA shut down other neurons saying not to fire, not to fire, not to fire. And when you inhibit neurons from firing, you get something called disinhibition, which is the relaxation that people experience. So let's talk about the diagnosis. As I mentioned in earlier videos, we're going to go through each specific substance of abuse independently. And alcohol falls into one of the categories called depressants. And here would be the criteria that needs to be met to give a person a diagnosis of alcohol use disorder. So we track the condition for a minimum of 12 months, and we have to see some level of clinical impairment. And you'll see that you need at least 2 of the following on this list. You'll need to see more and more of the alcohol taken, right? Or taking it over time that's greater than that which was intended. You need an attempt to cut down that's unsuccessful. You need a lot of effort going into securing alcohol, using alcohol, and recovering from its effect. We need the cravings that are there to use alcohol. Now, we'll talk about something called alcohol use disorder in remission. And the symptoms that I'm going down on this checklist, they all usually have to disappear for it to be in remission, with the exception of cravings, right? It is perfectly normal if a person previously used alcohol for them to still crave it, even though they're not doing it, right? So we'll talk about cravings there as well. So we also see that alcohol can interfere with your ability to perform major work functions, home functions, school functions. It can interfere with your social relationships. It could interfere with some of your recreational hobbies. It can cause physically hazardous situations, such as driving under the influence of alcohol. And it's continued to be used despite any kind of physical or psychological problem that was exacerbated. Now, I went through each of the criteria, but that doesn't mean you need all of them. As I mentioned, you need at least 2 from this section. But we also need to see that there is some tolerance, which is defined by needing increased amount of alcohol to achieve the previous intoxication, or a marked diminished effect if you use the same amount of alcohol. They're two sides of the same coin of tolerance. Withdrawal is manifest by either experiencing withdrawal symptoms of alcohol, or alcohol use or some other drug related to alcohol, as in benzodiazepine. It operates on GABA as well. So either taking alcohol or benzos to avoid withdrawal symptoms. So when it comes to withdrawal, you could either experience it or you could avoid it. And if you have that, you meet the criteria of an alcohol use disorder. But we still need to specify the impact it has on your life. I mentioned you need a minimum of 2 features to have the diagnosis. But if you only had 2 to 3 of these features, we would call it mild alcohol use disorder, right? Or alcohol use disorder with mild severity. Moderate severity is if you have 4 to 5 of these symptoms, and then severe is if you have 6+ symptoms. So that's the person who's currently struggling with alcohol use disorder, and they're still using or drinking alcohol. We have another category, though. We can still give an alcohol use disorder diagnosis even when it's in remission. Now, I'll explain what I mean. We have something called early remission. That's when a person previously met the criteria for alcohol use disorder, but they have not used and have not met the criteria for the last 3 to 12 months. So if 3 months have passed and the person has been clean and not meeting the criteria for alcohol use disorder, but it's less than a year, we call that early remission. Whereas if it's a year or longer, we call that sustained remission. So you might say, well, if a person hasn't used alcohol in the last year, why are we still giving a diagnosis of alcohol use disorder? Well, the answer is that even if a person has become clean and sober, they still can have challenges that have been caused as a function of the alcohol use, right? Or they might want to work on some of the unintended consequences of the alcohol use that still bother them psychologically. So if it's been longer than a year, but they previously met the full criteria for alcohol use disorder, we would give alcohol use disorder in sustained remission. Now, there is another scenario where a person isn't using alcohol, of course. That's if they are in a rehabilitation center. And we would refer to that as an alcohol use disorder in a controlled environment. Now, in a controlled environment, we're specifying that this person is not using alcohol at this point, but it's because they don't have access to alcohol. So how does alcohol impact a person? Well, we measure the impact of a person on a person based on the concentration of alcohol. So we talk about blood alcohol concentration, or BAC, and there's a certain number that is the threshold for intoxication. We'll get there in a minute. But BAC, or blood alcohol concentration, is impacted by a lot of different things. The first thing that impacts blood alcohol concentration is the size of a person. So if a person is larger than another person, the effect of alcohol is going to be less. The concentration is going to be less. So the smaller the person, the higher the BAC. We also know that gender plays a role, and this is because women have less of the enzyme that breaks down or metabolizes alcohol. So lower doses are going to have higher concentration. So if you have less alcohol dehydrogenase, then the alcohol is not being broken down in the stomach. Thus, even though you had the same amount as another person, it is possible that you have a higher BAC as a female We also see that at a given dose, on average, women become more intoxicated than men. So here is our breakdown of BAC. So blood alcohol concentration, if you have 0.06, that generally speaking provides a sense of relaxation or comfort. As I mentioned, it's a central nervous system depressant, so it's going to calm you down, relax you. At 0.09, we consider that intoxication. This is where the person is considered over the limit or drunk. You'll notice that some states have the threshold of 0.08 and other states have the threshold of 0.10. And sure enough, it's based on being on one side or the other of this intoxication threshold. Now, at its worst, if you have 0.55 or higher, you're at risk of death. But the good news is the oral route of administration or drinking alcohol in general is a slow route of administration. So it's going to be hard to get to that 0.55 because what's going to happen, your body is going to start to do things that tell you to stop. One, you might throw up. So that's your body saying you're polluting it. Two, you might get very sleepy, or you can have an entire blackout or lose consciousness. And that is one of your ways of your body protecting you from overdosing and die. So the organ that's responsible for metabolizing alcohol is the liver, and the average rate of metabolism is about 25% or 0.25 of an ounce per hour. And there's nothing you can do to speed up the process. You might have heard people say drink water. You might have heard people say drink coffee. You might have heard people say take a shower, open the window, eat bread. All of these strategies do not impact the speed of metabolism. The best way to make sure that you're sober is to wait it out. So you need to allow the body to do its thing. There are no shortcuts. Now, alcohol abuse and dependence, even though alcohol is legal, it's one of the most dangerous recreational drugs. In fact, second to smoking, it causes the most drug-related fatalities, right? So that's very important when we have a discussion about various drugs and their availability in society. Now, we do see that a person can develop an alcohol use disorder across the lifespan, but there are trouble periods where it becomes pretty pronounced. For example, alcohol use can already show as a problem in high school, college, and adulthood. So the annual incidence rate is roughly about 6%. Lifetime incidence rate is about 13 to 18%. And the alcohol use disorder itself is 2 times more common in men relative to women. So keep in mind the two numbers: 3 times more common for heavy drinking, 2 times more common for an alcohol use disorder. There are ethnic differences. We see that Caucasians, African Americans, and Hispanic individuals generally hover in about anywhere between 7 to 9%, whereas Asians tend to have significantly lower rates of alcohol disorders due to the same issue of deficiency in alcohol dehydrogenase. Right? That's the enzyme that's supposed to break down alcohol. So you'll see that small amounts of alcohol can induce significant reactions among Asians. You might even hear this colloquially referred to as Asian blush. So you'll start to see some physiological responses, even due to very small amounts of alcohol. So what are some of the issues when we talk about alcohol abuse and dependence? Alcohol abuse, the word abuse by definition means an abnormal usage. So the person is using alcohol other than its intended purpose. So the person might use alcohol to enable them to do things that would previously make them anxious, or talk to a person, maybe for dating purpose. But the problem with using alcohol outside of its intended recreational purpose is that it can, if you use it long enough, interfere with your work performance and your social functioning. We also see that there's a sense of dependence. The more you use alcohol, the greater the amount of the alcohol you're going to need for the effect. As I said, that is tolerance. And some of the withdrawal symptoms of coming off of alcohol include nausea and vomiting. And if a person is a very heavy drinker for a long period of time, you have to be very careful how you wean them off of alcohol, because if you rush too fast, you can induce something called DTs, or delirium tremens, which are they're dangerous, and they can be fatal. So the risk of DTs usually is about 2 to 3 days. So here are some of the long-term consequences of alcohol. We're going to talk about social consequences first, and then biologically speaking after. So social consequences, it is a very costly drug to address within society. So we spend about $150 billion addressing things like alcohol abuse and losses in society, whether it be what we're paying or whether you're not showing up to work, etc. We also know that alcohol abuse can result in increasing the risk of suicide, other forms of violence, so physical violence, rape, sexual assaults, and automobile accidents. Now, an additional problem is children of alcoholics, right? So there's roughly 30 million children of alcoholics who are raised in an environment that was unhealthy. And being a child of an alcoholic, this individual is going to struggle within society. So these are some of the social consequences, but we also have biological consequences. So if a person drinks alcohol for a long period of time, they run the risk of cirrhosis of the liver. So your liver plays an incredibly important function for blood processing and a whole host of other things. But the more you drink, the more you damage the liver. It can become scarred, and you could get like this white fatty substance to the point where your liver doesn't function properly. And that creates a problem. We also know that it can increase cognitive problems, something called Korsakoff syndrome, which is a deficiency of vitamin B due to alcohol use that causes memory loss, confusion, a form of neurocognitive deficit. So when a person has these memory deficits, it's not uncommon in the treatment room to see that a person fills in the gaps, making things up. We call that confabulations. And then, of course, the expectant mother, we run the risk of fetal alcohol syndrome. Now, fetal alcohol syndrome is a wide array of birth defects, such as low birth weight, facial abnormalities, heart defects, intellectual disabilities, and so forth, cleft palate, etc. Now, two things I want to say about fetal alcohol syndrome. There is a lesser form of fetal alcohol syndrome where you don't have all of the features or defects, right? Birth defects. You only have some, but not all. So we call that fetal alcohol effects when you don't have everything. And I want to dispel a myth. There is no safe amount of alcohol during pregnancy. So some people might say, oh, what's wrong with a glass of wine? We don't know the extent to which, even light drinking affects the development of a child. So according to the Center for Disease Control, There's no safe amount of alcohol during pregnancy. And that is basically our discussion on alcohol. So I hope that you would have learned how prevalent it is within society, the criterion for an alcohol use disorder, whether it be current usage or in remission. I hope you understood the role of blood alcohol concentration and the factors that impact BAC. I also hope you were able to detect some of the other differences, such as ethnic differences. And then obviously, I concluded on a very serious note of alcohol having significant social and biological consequences within society. So once again, thank you for listening. If you like the video, hit the like button, subscribe, click the notifications tab. But more importantly, if you have a reaction to the video, please write it in the comments. I read every comment. I react to every comment. If there's a video that you'd like me to do on mental health, I'm happy to do it. If you have any question or reaction or story you want to share, once again, put it in the comment section below. Until next time, everybody, take care.